Let me tell you something that happened in my clinic last year that completely changed the way I look at aging. A 63-year-old woman came in complaining of fatigue. She didn't think much of it. She figured it was just life catching up with her. But as I was doing a routine check, I glanced down at her hands, and I stopped. Her nails. They were telling me a story that her words never could. And within the next few weeks, we confirmed she had not one, but two serious underlying conditions, both of which had gone completely undetected for years. And the only reason we caught them when we did? Her nails. So if you are over 60, or you love someone who is, I need you to stop whatever you're doing right now and pay close attention, because what I'm about to share with you could genuinely save a life. Welcome. I'm Dr. Elara, and this is the Dr. Elara Health Channel, where we talk about the things that actually matter for your health, especially as we get older. Today, we are going deep into something most people completely overlook: their fingernails. And I promise you, by the end of this video, you will never look at your nails the same way again. Now, I know what some of you might be thinking. Nails? Really, Dr. Elara? But hear me out. Your nails are not just there to look pretty or to tap on a table when you're impatient. They are a window into your internal health. Every single thing happening inside your body, your circulation, your liver, your lungs, your immune system, it all leaves clues on your nails. And after the age of 60, those clues become even more important because that's when the body starts whispering before it starts screaming. And most of us miss the whisper. So let's talk about the 4 diseases your nails might be hiding right now, and the specific signs you need to look for. The first one is heart disease and cardiovascular problems. Now this one is close to my heart, no pun intended, because cardiovascular disease is still the #1 killer of adults over 60 worldwide, and it is notoriously sneaky. People feel fine until they don't. But your nails? They are not so good at keeping secrets. One of the most telling signs is something called clubbing. Now, if you haven't heard of this, here's what you're looking for. Normally, when you look at your finger from the side, there's a small angle where the nail meets the skin. With clubbing, that angle disappears. The fingertip actually starts to look wider and more rounded, almost like the tip of a drumstick. The nail curves downward over the tip of the finger. And this happens because when your heart isn't pumping blood efficiently, or when there's chronic low oxygen in the blood, the body responds by pushing more fluid and tissue into the fingertips. It's the body trying to compensate. Another cardiovascular sign is something called splinter hemorrhages. These look like tiny dark red or brown lines running vertically under your nail, almost like a splinter is trapped underneath. In many cases, these are caused by tiny clots or inflammation in the small blood vessels, which can be a sign of a condition called infective endocarditis, an infection of the heart valves, or other serious vascular conditions. Now, 1 or 2 splinter hemorrhages can happen from minor trauma, so don't panic if you see one. But if you're seeing multiple, in multiple nails, that's when I want you to take it seriously. And then there are blue or purple nails, or what we call cyanosis. This is when the nails take on a bluish tint, and it's a direct sign that your blood isn't carrying enough oxygen. In people over 60, this can be related to heart failure or even peripheral artery disease, where the arteries that carry blood to your limbs become narrowed or blocked. So the takeaway here: if your nails are clubbing, if you see multiple splinter hemorrhages, or if there's any bluish discoloration, please don't sit on that. Get to your doctor and specifically ask about your cardiovascular health. The second disease your nails might be hiding is liver disease, and this one surprises a lot of people because they assume liver disease always shows up as yellowing of the skin or eyes. And yes, jaundice is a classic sign, but by the time the skin turns yellow, the disease has often already progressed significantly. Your nails can catch it much earlier. One of the most well-known nail signs of liver disease is called Terry's nails. This is when most of the nail looks white, almost like it's been painted over, but there's a narrow pink or reddish-brown band at the tip. It almost looks like the nail has a little rim of color at the very end. This happens because the blood vessels in the nail bed change their pattern due to liver dysfunction, low albumin levels, or fluid accumulation. All things that happen when the liver is under serious stress. Studies have shown that Terry's nails appear in a significant percentage of patients with liver cirrhosis, so this is not a minor finding. Another sign is called Murky's lines. These are pairs of narrow white horizontal bands running across the nail, and importantly, they don't move when you press on the nail. They sit in the nail bed itself, not the nail plate. These are connected to low levels of albumin in the blood, which the liver produces. When the liver isn't functioning well, albumin drops, and the blood supply to the nail bed becomes disrupted, showing up as these pale horizontal lines. And then there's something called leukonychia, when the nails turn entirely white. This can be associated with liver cirrhosis, as well as nutritional deficiencies that often accompany chronic liver disease. Now, liver disease in its early stages is often completely silent. People don't feel it. That's why these nail signs are so critically important in people over 60, especially for anyone who has a history of alcohol use, has ever had hepatitis, takes multiple medications, or has been dealing with unexplained fatigue and weight changes. If any of those nail changes resonate with you, please bring it up at your next doctor's visit. The third disease is kidney disease, chronic kidney disease to be specific. And again, this is something that can simmer quietly for years, slowly damaging your body while you feel relatively okay. By the time most people are diagnosed, they've already lost a significant portion of their kidney function. But the nails, as always, are trying to warn you. One of the most distinctive signs of kidney disease in nails is called half-and-half nails, also known as Lindsay's nails. Here's what this looks like. The bottom half of the nail, closer to the cuticle, appears white or dull, while the top half, toward the tip, is pink, red, or brownish. It's like someone drew a line across the middle of your nail and colored each half differently. This pattern is directly linked to elevated waste products in the blood, what we call uremia, which happens when the kidneys can no longer filter the blood properly. Another sign is what we call Beau's lines. These are deep horizontal grooves or ridges that go across the nail. They look like the nail just kind of paused growing for a while and then picked back up, leaving a groove behind. Beau's lines can appear with any major illness that disrupts nail growth, but in the context of kidney disease, they often appear alongside other symptoms like puffiness in the hands, frequent urination at night, or unexplained fatigue. And here's something important I want to say about kidney disease specifically. It is more common after 60 than most people realize. High blood pressure and diabetes, both of which become more prevalent with age, are the two leading causes of kidney damage. So if you have either of those conditions and you're noticing any of these nail changes, please have your kidney function tested. It's a simple blood test, creatinine and eGFR, and it can tell you a lot. The fourth disease is one I want to talk about carefully, and that is diabetes. Specifically, poorly managed or undiagnosed diabetes. Now, many of you might already know you have diabetes or prediabetes, but what you might not know is that even if you've been managing it, your nails can reveal whether the disease is affecting your body at a deeper level. One of the most common nail changes associated with diabetes is slow-growing, thickened, discolored nails, particularly in the toenails. When blood sugar is chronically elevated, it damages small blood vessels, and this reduces circulation to the extremities. Less blood flow means the nails don't grow well, they become brittle, they yellow, and they thicken. This is also why people with diabetes are at much higher risk for fungal nail infections, because the altered circulation and immune function create the perfect environment for fungus to grow. Speaking of which, recurring fungal nail infections, what we call onychomycosis, are significantly more common in people with diabetes. If you're over 60 and you keep getting fungal nail infections that just won't go away or keep coming back, that's your body telling you something about your blood sugar and your immune response. There's also a condition called yellow nail syndrome, where nails grow extremely slowly, turn a yellowish color, and may even curve more than usual. While yellow nails have multiple causes, in older adults, this can sometimes be connected to diabetes, lymphatic problems, or even respiratory disease, and it's worth investigating further. Now, here's what I want to make clear before we move forward. I am not telling you to diagnose yourself based on your nails. What I am telling you is to use your nails as a conversation starter with your doctor. Too many people over 60 go to their appointments and say, "I feel fine," because they don't know what they're looking for. Next time, look down at your hands before you walk in. And if something looks off, if your nails are changing color, changing shape, growing lines you haven't seen before, or just looking different than they used to, say something, point it out, ask about it. Because here's the thing that I've seen time and time again in practice. The people who catch serious illness early are not always the ones with the most symptoms. They're the ones who are paying attention to the quieter signals. And nothing in the body is quiet without a reason. Now, before I go, let me give you a quick checklist of what to look for when you examine your own nails. You want to look at the color. Are they pink and healthy looking, or are they white, yellow, blue, or brown? Look at the shape. Do they curve downward at the tips? Has the angle at the base of the nail changed? Look at the surface. Do you see horizontal grooves, lines, or ridges? Look underneath. Do you see any dark streaks that look like splinters? And look at the overall texture. Are they thicker than they used to be? More brittle? Splitting more easily? Do this check once a month. Make it part of your routine. Sit in good light, remove any nail polish so you can see clearly, and really look. It takes 2 minutes, and it could make an enormous difference. I also want to say this. Please share this video with someone you love who is over 60. A parent, a sibling, a friend, a neighbor. Because so much of serious disease in older adults goes undetected simply because no one knew what to look for. And that's something we can change together, one video at a time. If you found this helpful, give it a thumbs up. It genuinely helps this channel reach more people who need this information. And if you want to keep learning how to protect your health as you age, subscribe to the Dr. Elara Health channel, because we come out with new videos every week covering exactly these kinds of topics, the things your body is trying to tell you that you might be missing. I'll see you in the next one. Take care of yourselves, and as always, stay informed, stay proactive, and stay healthy.